Hello again. Now, for some time, there's been a whisper, well, actually not so much a whisper, more like a roar, that diabetes can be reversed through dramatic weight loss. Not everyone agrees, and it's a contentious area amongst diabetologists. So to bring together some various opinions on this, we have Professor Roy Taylor from the University of Newcastle and Professor Michael Nauck from the Ruhr. Hello to both of you.
Hello.
Hello. So, Roy, this is your particular bag, and in the UK we're very familiar with Roy Taylor because he's been saying, it's very much been in the headlines all this week, that if you can't fit into the trousers that you were wearing when you were 21, then you are potentially at risk of diabetes. So, Roy, you're very clear on this. Just tell us more.
Yes. Just to clarify that message that's being carried by newspaper headlines, newspapers tend to pick up things perhaps in an improper context. For people who have type 2 diabetes, but they've got a normal or near normal BMI, they can get rid of it. But let me wind back to the start of this story, because this is 2006, when we finally got all our information on hepatic insulin sensitivity and what happened to liver fat. And suddenly, all the pieces of the jigsaw dropped into place. I was able to draw up the twin-cycle hypothesis of the cause of type 2 diabetes, which we published in Diabetology in 2008. And of course, it's no good having a hypothesis. You've got to go out and try and destroy it. And so we set up an acid test for this. We took a group of people with very ordinary type 2 diabetes and put them on a low-calorie diet specifically designed to be practical and acceptable. It turned out that it was, and the average weight loss was exactly what I had wished for, which is 15 kilograms. And lo and behold, all the predictions of the twin-cycle hypothesis came true. Liver fat fell to normal from very high levels. The fat export from the liver fell, and it stopped silting up in the ectopic sites, one of which is inside the pancreas. Now, we've known for a long time that in vitro, if you expose insulin-producing cells, beta cells, to excess fat chronically, then they will begin to lose their ability to secrete insulin. So the Counterpoint study set things on the map. But in order to test the hypothesis, we'd only studied people in the first 4 years of type 2 diabetes. And to condense the next decade of research rapidly, we've been able to show that it's duration dependent. After 10 years following diagnosis, the chance of getting full remission is relatively small. We've been able to confirm the mechanisms repeatedly, including the most contentious part of the mechanism involving the pancreas. And we're now in the position of being able to say, yes, this approach to weight loss is so simple, it can be rolled out in primary care for everybody, not by doctors, but by the nurses. It's so simple. The snag is keeping the weight off long term. Now, we can lose weight rapidly. People tell us it's much easier than the long-term bit. But even so, in our direct study, at 2 years, 36% were still free of diabetes. And even in that short study, there was a major signal that cardiovascular disease was less. Certainly, new cancers were dramatically reduced. And put together, that was a significant reduction in overall risk to health. So at 2 years, yes, that's big news. So why don't I stop there, having just outlined where we've come from, which is testing ideas and then probing them with cutting-edge methods to look inside the body to see what happens.
Michael, would you like to respond to that? Because is it about the amount of weight loss or the percentage of weight loss? And can it be sustained?
Well, the sustainability issue is the difficult part, as Roy has just mentioned, because many people succeed in reducing their body weight acutely, let's say for 3 months or so. But of course, we don't want the benefits of weight loss just for a short period of time. So we aim at diabetes remission for as much time as we can achieve. Maybe I should add that there is another way of inducing such major weight loss, and that is bariatric surgery. So gastric bypass, sleeve gastrectomy, different procedures. And they really can achieve major weight loss, minus 20% plus, which usually persists for a very long time. And usually in those who undergo this surgery with pre-existing type 2 diabetes often experience diabetes remission.
So remission is possible, but as Roy says, that this is weight loss that can be patients can be assisted with their weight loss by a nurse rather than a doctor, or a surgical procedure is obviously a big advantage. But I think you take your message further, wouldn't you, Roy, that actually you really need to be getting hold of people at a time of life when they might be tipping into type 2 diabetes, and that's the time to get them. That's the time when you can make most difference.
Yes, that's absolutely right. Although we need to be quite realistic here. In order to take action and go down the dietary road to substantial weight loss, about 15 kilograms for most people, then people have to be motivated to do it. Now, the diagnosis of pre-diabetes, that's a very useful form of words, because that conveys to people, yes, that this disease that they know might pose a risk to eyesight, might pose a risk to limb, premature death, it's a bad sounding number. People will respond at that level. Now, the work that I've presented at EASD this week is very pertinent here, because it deals with people who look as though they're slim. Well, we can tell them they're not slim because they've got abnormal amounts of fat inside the liver. Interestingly, if you compare it with the population norm, it doesn't look too bad. But if you compare it appropriately with people in the same range of BMI, then it's about 2.5 times raised. And we see with weight loss in this group, now this group only need 10 kilograms weight loss. First of all, they get back to the waist size that they had when they were 21. That's where the strap line comes from. And secondly, the diabetes goes away. And goes away, well, in 2/3 of the group that we've studied so far. We have identified some people with monogenic diabetes, one person with slow onset type 1. We've got to be very careful with diagnosis in this group. So yes, for younger people, and bear in mind that the decade in which the greatest weight gain occurs throughout life is in the 20s. This is a potent message. So we could put it into a little packet, if you like. If you've got a family history of diabetes, make sure that you don't put on weight beyond the age of 21. That would be a very sound message that I hope Michael would agree with. I take entirely the point about other means of weight loss. We've got exciting drugs on the horizon that might help us. But bear in mind, my work was directed towards understanding the mechanisms, finding out what caused diabetes. I believe we've done that, but it's a matter of the application that we're now talking about. And I think the application to young people is especially engaging.
Michael, I have to tell you that in the UK, when we saw all those headlines, everybody I met said, is anyone fitting into their trousers that they had when they were 21? So there was a bit of kind of, oh no, we're all doomed going on. So I happen to know that Roy is in the trousers that, not in the same trousers obviously, but is in the trousers that waist size that he had when he was 21. But there's an awful lot of us that are not. Michael, how do you feel about that?
Well, this is certainly not applicable to my body weight history. And the problem associated with this. So I think Roy is exactly right that the decade between 20 and 30 years is when you start putting on weight. But who at this age would go to see a physician because he has put on 3 kilograms of weight? I think we have to raise the awareness, and we have to design programs that make it possible that at that stage you can do something, because you certainly need an intense program. And if Roy says physicians are probably not good for that, it should be a nurse-based program. That is because you need repeated encounters. You will have to deal with disappointments and changes in body weight in the wrong direction and all these things. So this requires a lot of effort.
Can I establish one
comment?
Oh, sorry, come back, Roy.
Could I comment there? Because that's really very important. Michael makes a really important point that people in their 20s have got things to do. They don't want to be sitting in doctors' waiting rooms. No, no, no. But this is not a message we want to have medicalised programmes putting over. We need to get it into the woodwork so that Granny tells the young people, you make sure you don't put on weight beyond when you finish growing, my lad. Now, it's a matter of an apple a day keeps the doctor away. It's getting the idea out into society. Now, at the present time, society is blithely unaware that it is not biologically necessary to put on weight beyond the early 20s. There's no extra bone that's growing. There's no extra brain that's growing, unfortunately. Any extra weight gain, sadly, is fat or fatty tissue more strictly. So we need to raise awareness gently in such a way that doesn't either drive people to foolish dieting and also doesn't cause undue worry. But we have to try and normalise the matter of just keeping an eye on the weight to make sure that you don't increase in clothes size.
Do you think we've established that, I mean, clearly we see it with bariatric surgery. Do you think we've established that type 2 diabetes in its early stages is reversible? Because it seems to be something that is still pretty hotly contested by quite a number of people in primary care. I don't know whether that feeling is right throughout diabetes. Michael, what's your thought on that?
Well, we need dedicated programs. If we just do things like we used to do them, it will not happen. So the DIRECT study is a very good example of a dedicated team that really was very successful in making these type 2 diabetic patients lose weight and maintaining that weight loss for at least a period of 1 or 2 years. And this gave us the idea to talk about diabetes remission, because suddenly this happened and we didn't have a name for it. But if you have diabetes and suddenly you have a normal HbA1c and you have lost substantial body weight, how are you going to call it? And this gives the idea, and it's an idea for the future, so that hopefully more people will benefit from programs like this one, with the aim of putting an end to their diabetes.
Well, Roy, you've certainly put it on the front pages and people are much more aware of it. We've been talking all throughout these sessions on EASD TV about the importance of raising awareness of diabetes, and absolutely this message that lose a lot of weight and you can put it into remission if it's early, and the message about your trouser size, that really has hit home. So thank you to you both for coming to talk to us about this today. It's very much appreciated.
Pleasure, thank you.
My pleasure.
There's more to come. Bye for now.